Welcome to American Scandal Report by Skoob. I'm your host, OZ Dalton, and today we're diving deep into one of the most shocking betrayals of medical ethics in American history. Between 1932 and 1972, the United States government conducted an experiment so morally reprehensible that it would reshape medical research forever. This is the story of how 399 men became unwitting guinea pigs in a study that prioritized scientific curiosity over human dignity, and how their suffering exposed the darkest corners of institutional racism and medical manipulation. Picture this: it's 1932, rural Alabama. The Great Depression has devastated communities across America, but nowhere is the impact more crushing than in Macon County, where poverty stricken African American sharecroppers struggle to survive. Into this desperate landscape steps the US Public Health Service with what appears to be a humanitarian mission. The initial plan seemed noble enough: study the prevalence of syphilis and test the effectiveness of existing treatments. But here's where the story takes its first dark turn. The 1929 stock market crash had already pulled the financial rug out from under the treatment component of the study. What began as a mission to heal transformed into something far more sinister. From over 4,000 individuals screened, researchers selected 399 men infected with syphilis, along with 201 uninfected men to serve as controls. These weren't random selections. They were primarily impoverished, illiterate sharecroppers, chosen specifically because of their vulnerability. The researchers understood exactly what they were doing: exploiting social vulnerability to recruit and retain research subjects. The study was officially titled the Tuskegee Study of Untreated Syphilis in the Negro Male. That title alone should have raised red flags, but in 1932 America, the ethical implications were brushed aside with disturbing ease. And now let me tell you about the masterpiece of deception that was orchestrated. Dr. Vonderlehr and his team didn't just conduct a study. They created an elaborate theater of lies that would run for 4 decades. The 399 men suffering from syphilis had no idea they were infected with a sexually transmitted disease. Instead, they were told they had bad blood, a vague term that could mean anything from fatigue to poor nutrition. The deception was breathtakingly comprehensive. These men believed they were receiving cutting-edge medical treatment, complete with free healthcare, transportation to the clinic, meals, and even burial insurance. But what were they actually receiving? Aspirin and iron tonics. Let me repeat that: men dying from syphilis were being given aspirin and vitamins while believing they were getting life-saving treatment. Each year, like clockwork, these unsuspecting individuals were rounded up in Macon County. Picture the scene: men waving to their neighbors as nurses drove them to what they thought was their annual treatment. A sense of trust developed, particularly with the public health nurse who saw them at each visit. Nurse Rivers would later recount how these visits evolved into social events. A cruel irony considering the men were unknowingly marching toward their own demise. The researchers marveled at the simplicity of their 4 decade study. For the young doctors involved, this was career gold, an opportunity to gain experience in clinical diagnostics and participate in what they believed was groundbreaking research. After their time in Alabama, they'd return to their regular duties, write scientific papers, and give no more thought to the men they'd left behind to meet their inevitable fate. To understand the true cruelty of this study, we need to follow syphilis as it ravaged these men's bodies while doctors took notes, like they were observing lab rats. Syphilis is a beast that destroys in stages. It begins deceptively: a small sore appears and then vanishes, fooling victims into thinking they're cured. 6 to 8 weeks later, more symptoms emerge. Then comes the latency period, where victims feel relatively normal while the spirochete organism silently embeds itself into tissues and organs throughout the body. Finally, the tertiary stage arrives like a nightmare. As years passed, the men's health deteriorated catastrophically. They experienced a steady rise in eye disorders and headaches. The pain started as vague discomfort, but intensified relentlessly. If spirochetes lodged in bone marrow, victims suffered deep bone pain. If the microbes spread to essential organs, pain radiated throughout their entire bodies. Over time, the agony became unbearable as bones were literally eaten away by growing spirochetes. For those who developed cardiovascular syphilis, the aorta and aortic valves eroded, causing heart malfunction that led to death through heart failure or suffocation. But the most disturbing cases were those where syphilis infected the central nervous system, including the brain. Imagine the confusion these men must have felt. They believed they were receiving treatment, yet their health continued declining. After years of increasing numbness in their limbs, caused by nerve and sensory receptor degeneration, they began to suspect that even the US government couldn't help them. They were tragically correct. The neurosyphilis patients became the most intriguing cases for researchers in the study's final years. But anyone with basic knowledge of syphilis progression would find it shocking that human beings were denied treatment just to observe the disease's tertiary effects. Here's where this story reaches peak moral bankruptcy. In the early 1940s, penicillin revolutionized syphilis treatment. The very same public health service conducting the Tuskegee study began using penicillin in clinics nationwide. This wasn't some secret discovery. By 1947, penicillin had become the standard treatment for syphilis. So surely you might think the Tuskegee researchers would celebrate this breakthrough and finally treat their subjects? You'd be catastrophically wrong. The Tuskegee directors made a calculated decision. They would not provide penicillin to their study subjects. In fact, they used penicillin's effectiveness as justification to continue the study, knowing they would never again find such a large group of untreated individuals. Let that sink in. A cure existed, and researchers deliberately withheld it to preserve their study. They didn't just passively observe, they actively prevented treatment. Hospitals and military facilities were instructed not to provide penicillin to study subjects. State and local health officers, medical practitioners, and even the Tuskegee Institute itself supported the public health service in blocking these men's attempts to seek treatment elsewhere. A key study member proclaimed in 1950, "We now know that we have contributed to their ailments and shortened their lives." They knew they were killing these men, and they continued anyway. The study's goal, as one researcher coldly stated in 1936, was to observe untreated syphilis from the disease's onset to the patient's death. They wanted to watch these men die, and penicillin threatened to ruin their experiment. Let's address the elephant in the room. Did these men ever agree to be human test subjects? The answer is an unequivocal no. Available records make it crystal clear. Subjects were taken advantage of, manipulated, and deceived. They weren't treated as human beings with rights and agency. They were research objects, no different from laboratory animals. The fundamental ethical violation wasn't just that subjects weren't treated, it was that they were never properly informed about the research project, its potential impacts, or their alternatives. They had no idea they were even in a study, let alone one designed to document their suffering and death. Prior to the study's initiation, researchers already knew that individuals with untreated syphilis had higher mortality rates than those receiving treatment. The study confirmed what was already known, making the entire exercise even more pointless and cruel. The life expectancy of at least 40 subjects was significantly reduced due to lack of treatment, a fact occasionally mentioned in published reports as late as 1971, though subjects were never informed. This violated basic medical ethics that were well established even in the 1930s. The principle that no experiment should be carried out if it could harm the subject was ignored completely. Ironically, this same principle was used to prosecute German doctors, who conducted experiments in concentration camps during World War II. American Medical Association representatives testified at the Nuremberg trials that research like the Tuskegee study would be unacceptable anywhere in the civilized world. Yet the study continued even after the Nuremberg Code was widely circulated within the medical community. Was the Tuskegee study driven by racism? Absolutely, though perhaps not in the way you might expect. The study was undoubtedly racist. It was primarily driven by the fact that subjects were African Americans, and it's impossible to imagine it being prolonged for 40 years without this racial element. Race became a factor when officials debated terminating the program in the 1960s. The government found it challenging to ensure death benefit payments for subjects unless the study continued, and these men were relying on those payments as funeral insurance. Terminating benefits might have exposed the study to public scrutiny. However, the researchers weren't overtly racist in their motivations. They sought assistance from the African American community and were devoted to expanding public health services for African Americans. But this surface-level good intention masked a deeper, more insidious form of racism. The physicians firmly believed that syphilis affected different racial groups in distinct ways. They thought neurosyphilis was less common in blacks than whites, and that heart disease was more prevalent in African Americans. They used these beliefs to justify continuing the study, even though they couldn't properly monitor for neurosyphilis because subjects refused additional spinal taps. Here's a crucial point that's often misunderstood. The study's primary goal wasn't to prove racial differences in disease progression. The American doctors were actually trying to challenge findings from a previous study conducted in Oslo, Norway. The Oslo study suggested that in two-thirds of untreated syphilis cases, there would be no adverse effects. American doctors doubted this data and wanted to prove it wrong, a goal with implications for how limited public health funds were allocated during the Depression. But regardless of their stated scientific objectives, the researchers' willingness to exploit vulnerable African American men for decades reveals the racist assumptions underlying their work. For 40 years, this medical atrocity remained hidden from public view. But in 1972, the wall of secrecy finally cracked. News of the study leaked to the Washington Star and New York Times, and the public reaction was swift and furious. Americans were horrified to learn that their government had conducted human experimentation that would have been at home in a Nazi concentration camp. The subsequent public outrage led to congressional hearings and the appointment of an advisory panel. When experts examined the study, they deemed it medically unjustified and immediately ordered its termination. The damage assessment was staggering. By 1972, only 74 of the original participants were still alive. 28 men had died directly from syphilis, 100 from related complications. 40 wives had been infected, and 19 children had been born with congenital syphilis. Even faced with this carnage, public health service officials refused to acknowledge wrongdoing. They defended the study with breathtaking audacity, claiming they had merely observed men who wouldn't have received treatment anyway. They argued that subjects were free to leave and seek treatment at any time, ignoring the fact that these men believed they were already being treated and were systematically prevented from seeking outside help. Officials claimed the men were volunteers who were happy to see the doctors. This defense was as insulting as it was false. How can someone volunteer for something they don't know exists? The exposure of the Tuskegee study triggered a seismic shift in medical research ethics and civil rights. A class action lawsuit filed by the NAACP resulted in a $9 million settlement for surviving participants and infected family members, along with free medical treatment. While money couldn't restore the decades of suffering or bring back the dead, it represented some acknowledgement of the government's crimes. More importantly, the scandal led to fundamental reforms in medical research. The study prompted creation of the National Human Investigation Board and establishment of institutional review boards in 1979. These oversight bodies were designed to prevent future atrocities by ensuring proper informed consent and ethical review of research involving human subjects. The Tuskegee study became a cautionary tale taught in medical schools and ethics courses worldwide. It demonstrated how easily scientific curiosity could override basic human dignity when combined with racial prejudice and institutional power. But perhaps the most significant moment came in 1997, when President William J. Clinton issued a formal apology on behalf of the United States government. Standing before survivors and family members, Clinton called the study deeply, profoundly, morally wrong and an outrage to our commitment to integrity and equality for all our citizens. As we conclude this investigation into one of America's darkest medical chapters, we must grapple with the lasting implications of the Tuskegee study. 3 crucial features highlight the consistent research abuses that occurred over 4 decades. First, the study involved systematic deception about the existence and nature of the research, depriving individuals seeking care of the right to decide whether to participate as subjects. Second, it deliberately exploited social vulnerability to recruit and retain research subjects. Third, researchers intentionally denied subjects access to appropriate and available medical care in order to further their study objectives. The Tuskegee study wasn't an accident or oversight. It was a deliberate, sustained violation of human rights that continued for 40 years. It reveals how institutional racism, scientific arrogance, and government power can combine to create unspeakable cruelty. The study's impact extends far beyond its immediate victims. It contributed to lasting mistrust of medical authorities within African American communities, mistrust that persists today and affects everything from vaccination rates to clinical trial participation. When people express skepticism about medical recommendations, the shadow of Tuskegee often lurks in the background. We cannot undo the suffering inflicted on those 399 men and their families. We cannot restore the years of life stolen by withheld treatment or heal the generational trauma caused by medical betrayal. But we can ensure their sacrifice wasn't meaningless by remaining vigilant against future abuses. The Tuskegee study stands as a permanent reminder that ethical oversight isn't optional, it's essential. It shows us that good intentions aren't enough when they're built on foundations of deception and exploitation. And it proves that the medical community's oath to first do no harm means nothing without the institutional structures and moral courage to enforce it. The men of the Tuskegee study deserved honesty, dignity, and care, yet they were reduced to data in an experiment that valued knowledge over human life. Their story is not just history, it's a warning about what happens when power goes unchecked and ethics are ignored. Remember the cost paid by those 399 men in rural Alabama and ask yourself, what truths remain buried and who decides when they're revealed? This is only part of a much deeper story waiting to be uncovered. Download the Skoob app now to get access to the full story and continue exploring the investigations that challenge what we think we know. Stay curious, stay questioning, and never forget the human price behind the headlines.